Good evening. My name is Marcus Daniels. I am a BSN nurse who currently works at a inpatient psychiatric facility and have worked in various psychiatric facilities over the last year and a half. I am a psychiatric nurse practitioner student at Regis College, and I want to speak with you a little bit about legislation and some of the changes that I feel could be made to the behavioral health services. Basically, healthcare legislation and health law are various laws and rules at the federal, state, or local level, and what they ultimately do is they help regulate and guide the delivery of healthcare services as it relates to suppliers, payers, vendors, and ultimately how we should be acting legally in regards to a person's healthcare and their rights. I think that there should be some changes made to healthcare, specifically relating to behavioral health services. I feel currently the Affordable Care Act made it to where there were more services for people, and there are some good behavioral health options for individuals, but mainly individuals within the Medicare and Medicaid services, but not the private insurance sector. And I feel that the proposed changes with the Medicare for all from the Bernie Sanders and his proposed changes would be beneficial to put into place. Some of the many issues that are faced right now in the behavioral health services are, for example, only 61% of private plans cover mental health and 54% cover substance abuse treatment. Not just issues with coverage in those areas, but in the aspect of cost and medication. A lot of insurance plans will cover medication for behavioral health, but then they will change their coverage for certain medications, even if those medications have been used by that patient for an extended period of time and are proven useful. They no longer deem them something that the patient can use because they're not covered by their plan, even if it's therapeutic. So that patient is now left to find something different. The new proposed plan would provide the same coverage to every individual, so there wouldn't be private plans that could pick and choose the way that they are currently, and patients could have the services they need to where they can seek counseling and preventative behavioral services as well as medication management and not have to worry about insurance no longer covering what they're currently on. I'd like to thank you all for your time, and I hope you have a great night, and thanks again for listening to me and speaking about why I feel Medicare for all and the Bernie Sanders plan should be put into effect to make appropriate changes to behavioral health services.